I'm Claudia Friedlander. In this video, I'm going to talk about the reasons so many singers complain of jaw tension and offer some methods for solving this common problem. The masseter, the main muscle of the jaw, is the strongest muscle in the body based on weight. Our ancestors required tremendous jaw strength in order to chew and digest raw meat and vegetables. People hold tension in their jaw muscles for all kinds of reasons. For me, when I was younger and very outspoken, I developed a habit of clenching my jaw in order to keep myself from saying things that could get me in trouble. These are just some of the reasons that our jaw muscles are often far stronger and far more active than we need them to be for articulation in classical singing. The jaw comprises a pair of bones, the upper jaw, or maxilla, and the lower jaw, or mandible. The maxilla is fused with its neighboring skull bones and does not move. The mandible is attached to the skull at the temporomandibular joints. This image shows the position of the mandible when the jaw is closed. The temporomandibular joints are highly versatile and unstable, enabling the mandible to move up and down, forward and back, and side to side. For the purpose of this discussion, we're primarily interested in the jaw movements involved in articulation, rotation, and translation. When you begin to open your mouth, the movement of the mandible is called rotation. The mandible swivels down like a hinge, opening up 1 to 2 fingers width of space between your upper and lower front teeth. As the jaw continues to lower, it also slides forward. This movement is called translation. Place your hands on either side of your face and then slowly open your jaw wide. You should be able to detect the moment when the mandible moves from rotation into translation. How wide open should your jaw be when you sing? Because our bodies are unique, I think it varies from singer to singer, and teachers with different pedagogical approaches will answer this question differently. In my teaching, I generally recommend that you allow your jaw to release into rotation when you're not intentionally engaging it, because holding it more closed than that may limit your resonance, while opening it too far may interfere with laryngeal movement. But it isn't the purpose of this video to tell you what to do with your jaw, but rather to make sure you can do what you intend to do with it and discourage it from being too tight or overactive. The two main muscles governing jaw movement are the masseter and the temporalis. The primary function for both is mastication. Singers may neglect the temporalis because the bulk of this muscle is located so far from the action of the jaw, but it is important to release and stretch this important muscle of the jaw as well. Because our articulators are so versatile, there are multiple ways to make most of the sounds we use in language. That means we can choose how to make each sound we need when singing based on what will be best for our technique and to project our voices. I have some basic guidelines that I like to refer to when deciding how to best articulate each sound we need to make when singing. The most important of these guidelines is that you engage and move only those articulators that are essential. So your default jaw position should be relaxed and open, and whenever there's a sound you can make without closing your jaw, don't engage your jaw. This is much easier said than done, because we use our jaws for most of the sounds that we make in speech. It's just a habit that we develop. You can see that my jaw is quite active as I share all of this with you. However, we don't actually really need to use the jaw to articulate any of the vowel sounds, or most of the consonant sounds we form when singing. For example, sibilants like s or sh. Those sounds are going to require that I close the jaw. I can't make those sounds without closing my jaw. Consonants that require my lips to touch, like or that I need to form by touching my top teeth against my lower lip, like v. I'm going to have to move my jaw a bit for those consonant sounds. But with the exception of just a few consonants, there just aren't that many sounds that we need to use our jaw for. However, we habitually use our jaws in speech for sounds like e, n, and o. I can use my lips to make o, but if I'm just speaking, I'm just going to go o with my jaw in a fairly closed position. So we're going to have to train ourselves to articulate these sounds in a way that is better for singing and engages the jaw as little as possible. When working with muscles that are tight or overactive, The first step is to release them. Small handheld massagers are great for releasing the jaw. So I've got two of them here, and I'm going to apply them on either side of my jaw, first on the masseter muscle. First, find your masseter muscle. If you place your hands on the sides of your face and bite down, you're going to feel a little bit of a bulge right there. That's the masseter, and that's the first muscle that I want to massage. So I'm going to place a massager on either side of my face, and what I'm going to do is I'm going to slowly open and close my jaw while keeping the massagers rubbing on the masseter muscle. So and I'm just going to continue opening and closing my jaw, encouraging the muscle to release, and noticing things like, is my jaw tighter on one side or the other? Is the movement jerky or is it really smooth? And just see if I can get that muscle to relax a little bit. To massage the temporalis, you want to place the massagers right above your eyebrows on either side where you're going to feel a little bit of an indentation. And same thing, open and close your jaw slowly while leaving the massagers in place. When using external massage to release a muscle, it's best to just let the massager stay in one place and move the muscle. It's going to penetrate the muscle better all the way to the tendon. Your instinct might be to move the massager around. It might feel really nice, but it's going to be more effective for releasing the muscle if you just leave it in one place and then move the muscle around, in this case, slowly opening and closing your jaw. Once you have released a tight muscle, the second step is to stretch it. When you're stretching a muscle, whether it's your hamstrings or your jaw, be sure to hold the stretch for at least 30 seconds so that tight muscle fibers have an opportunity to relax and elongate. For the jaw, what I'd like you to do is first open your jaw as wide as you comfortably can. Don't force it down, but you want to just slowly open your jaw. And then once it's nice and open, take the fingers, the forefinger, middle finger of each hand, and gently hook them over your lower teeth, and then exert just a gentle downward pull so that you can increase the stretch a little bit, like this. Be sure to keep breathing while you do this. Don't go any farther than you comfortably can. And again, hold the stretch for 30 seconds or longer so that the muscle fibers have an opportunity to respond to the stretch. Now that you have encouraged the jaw to relax, it's time to train it to remain relaxed while engaging your other articulators. Practice articulating phonemes that habitually activate your jaw by just using your tongue and/or lips as appropriate while keeping the jaw relaxed. For example, a lot of us habitually use our jaw to articulate the consonant N, and so it's going to look something like this: ah, na, 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 na. But I don't need my jaw for N. I can allow my jaw to stay relaxed and just use my tongue. So I'm going to just gently place my hands on the side of my face or use a mirror, just so that I can find out, is my jaw moving or not? Encourage it to stay relaxed, and then see if I can just use my tongue to articulate the N. Ah, na, 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 na. And my jaw muscles can stay very relaxed while I'm doing that. One of the vowel sounds that we all like to use our jaw for is E. We pronounce E. E by sort of lateral spread of the lips with the jaw closed is generally how we learn to say E, but we don't need to use the jaw for E, so let's not. You can just use your tongue, just arch it a little bit further forward from where it would be for ah, which also doesn't use your jaw, and you can articulate a good E vowel that'll be nice and resonant for your singing without having to close your jaw. Ah, E, ah, E, ah, E, ah. Any vowel or consonant that has you habitually engaging your jaw that you suspect you might not need your jaw for, just try moving between ah and that consonant or that vowel by using your other articulators, your tongue, your lips, and see whether you can actually leave your jaw relaxed. Now you can train your jaw to be more disciplined while learning repertoire. I'll demonstrate how to do this using the first phrase of Wie Melodien zieht es by Johannes Brahms. The text we're going to work on is Wie Melodien zieht es mir leise durch den Sinn. Notice that some of the consonants in this phrase require jaw movement while others do not. First, I'm going to practice the consonants that do not require jaw movement. I'm going to practice moving between the vowel sound ah and the consonant, trying to just move my tongue and not my jaw for these sounds. So we'll start with the L, as in melodien. I can go ah, la, 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 la. I can feel that my jaw really wants to move on that L, so it's really helpful to remind it that it's just the tongue that we need for articulating the consonant L. The D and the N and the T are all in very similar positions to that L. As you can see, I can go ah, da, 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 ah, na, 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 ah, ta, 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 really just using the tip of my tongue against the back ridge of my teeth, and I don't have to move my jaw. The ach-laut also does not require using the jaw, as in durch. So I can go ah, ha, 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 and I can feel how towards the back of my tongue it can make an aspirate sound against the roof of my mouth, and I don't have to use my tongue to actually make that consonant sound. So getting the jaw out of the way for the consonants that don't need it is the first step. Then we see that there are these 4 consonant sounds that we are going to need to engage the jaw in order to articulate well: the V, the M, the S, and the Z. When articulating these sounds, I want to move my jaw as swiftly and simply as I can so that it can return to a relaxed position and I can sing on the vowel. So I'm going to practice going ah, va, va, va. How little do I have to move my jaw, and how quickly can I move my jaw is what I'm looking for. Ah, ma, ma, ma. I can get a nice quick M just by touching my lips together and then allowing my jaw to return to an open position. S and Z are unvoiced and voiced versions of the same sound, so it's really the same movement. If I go ah, sa, 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 or ah, za, 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 the only difference is that my voice remains engaged on the Z, whereas s, it disengages on the S. Now that I've practiced these individual jaw movements, or practiced having my jaw be relaxed when I don't want it to move, I can try to articulate this phrase and see if I can move my jaw only when I intend to. And again, I want to get some feedback from either my hands or looking in a mirror, because it's very hard to tell when your jaw is moving. We don't get a lot of sensory feedback from our jaw muscles, so some tactile or visual feedback is really useful when working with the jaw. And I can say, Wie Melodien zieht es mir leise durch den Sinn. And I did move my jaw less than I would have had I not practiced that. But it takes constant reinforcement, again, because we have these habitual speech movements. We're used to engaging our jaws in most of these consonant sounds that I have to make. But when it's time to sing, figuring out how to make these sounds without engaging the jaw is going to provide for more consistent resonance and a better legato, even in languages like English and German that have so many interesting consonant sounds. I titled this tutorial, How to Relieve Jaw Tension. But as you can see, it is necessary to not only alleviate jaw tension, but also to retrain jaw usage so that it functions effectively in articulation, and so that once relieved, the tension doesn't come back. Tension tends to get a bad rap from singers and voice teachers. When we refer to tension, it's usually as something that we need to get rid of. But think about it. Tension is just muscle activity. Muscles function by tensing and releasing, and there's plenty of positive muscle action that contributes to our ability to sing. So instead of always thinking about tension as something that needs to be released or gotten rid of, try distinguishing between tensions that are intentional, habitual, or chronic. An example of intentional tension would be, I'm going to engage my tongue to articulate this consonant while also relaxing my jaw. Habitual tensions include speech habits, where you might engage your jaw to articulate an E vowel and end up with diminished resonance. Chronic tensions result from muscular overuse, such as the tightness that I used to experience because I was holding my jaw rigidly closed as a means of self-censorship. Chronic tensions can be resolved through massage and stretching. Habitual tensions can be replaced with intentional activity. Thank you for joining me. Please see the video description below for additional resources.